Good morning. Happy spring. It looks like spring outside, doesn't it? I love the sun. All right, so close. All right, annual wellness visits. Let's get this going. No? Oh, maybe it's... Okay. There we go. All right, population health and wellness nurses. There's me and 3 other gals. So as my intro stated, I've been a nurse for 18 years, and the last 5 I've had the pleasure to work at CRMC in their population health and wellness department. So what is a population health nurse? Well, I get to work closely with my providers on 2 big components, chronic care management and annual wellness visits. And that's what I'm talking to you guys about this morning. All right, so what is it? Good question. Okay, so if you're on Medicare, it's a free benefit to anyone that's enrolled. You can be on a traditional plan, or you can be on an Advantage plan, like your UCares and your Humana plans. It's a unique visit where you get to meet with your care team and focus on overall health and preventative screenings. So I like to think of it as you're coming in well, you're not coming in with a sprained ankle or a problem. So it's not a problem visit, it's a well visit. So what are the benefits of these visits? You get to establish that yearly connection with your provider, and it's actually more than 5 minutes. So you actually get to have that nice time to spend with your care team. We make a personalized prevention plan, and that is just a clear, easy to follow, and unique to you plan for your health. And this plan will identify the steps to stay healthy, active, and independent as possible, which is our goal as we get older. All right. Okay, I'm sorry if the screen's a little tiny here. There's different boxes saying what's all involved in this visit. So I'll just go over those real quick here. Obviously, we're going to check height, the weight, your BMI, blood pressure. But health is so much more than just your numbers, right? We'll talk about your medications, supplements, vitamins that you're on. We'll talk about personal and family history. We'll review your daily routines and talk about home life, safety, your risk for falls and injury. I don't think anyone wants to fall as you get older. You never bounce back well from that. We'll also talk about any problems affecting your memory or affecting your health and well-being. We'll create that personal prevention plan. What else do we do? We make decisions about your care that you would want to receive if you were unable to talk. So that's that big healthcare directive piece. You'll receive personalized health advice based on your risk factors. Your care team will help plan out a plan for working on weight loss or nutrition assistance, how to prevent falls and injuries. And lastly, if you're needing any vaccines, to help your overall health, like flu shot, pneumonia shot. Those things are also covered in that visit. So we're covering a lot. At CRMC, it's about an hour visit. We have a dual visit, so half the visit is with the RN, me, and then the other half is with the provider, and we work as a nice team. All right, why do we want to plan to stay healthy? Well, if you stay healthy, it lowers your healthcare costs. You can learn to make small changes that will affect your overall health as you get older, and we can detect disease early. So we are preventing instead of reacting. I think all of us have heard that quote by Benjamin Franklin, "An ounce of prevention is worth a pound of cure." Let's see here. Oh yeah, so remember, it is easier to stop things from happening in the first place than trying to repair the damage after it's happened. the cost of preventing disease is obviously a far less than the actual cost of treating the disease. And there are even some more benefits to coming in for your yearly visit. Empowerment. Those wellness visits do empower you, the patient, to receive all the recommended screenings and items that Medicare does cover to you. It gives you the opportunity to connect with additional services, either in a clinic setting or even in our community setting. It helps you thrive as you get older. I think that's one of our main goals. And we get to have discussions around healthcare directive. Think of that advanced care planning. Who here in the audience has a healthcare directive complete? Oh, fabulous! I love seeing that. Good job, you guys. So promote to your other family and friends to get their healthcare directives filled out. It involves discussing and planning for your future if you couldn't speak for yourself. Highly promote those. All right, so we're kind of hearing that wellness visits are a win-win for both you and your provider. The provider gets to know you a little bit better. They get to spend extra time hearing about health and wellness, what we're doing to work on it. But remember, early disease detection is the key as we get older. We want to prevent accidents at home. We want to strengthen relationships with your care team. And hey, there's no copay to this visit. If we can decrease hospitalizations, I think that's a win for everyone. So how do you get a wellness visit completed? You would just call your clinic that you go to and ask for your yearly Medicare wellness visit. It is not a physical. That's a little bit different. Once you're on Medicare, they promote the wellness side of visits. If you're interested in CRMC, we have a variety of locations. Longville, if you're from up north, we have Breezy Point just down the road. I'm located in Crosby. We have a new Super One clinic, which is just part of the new Super One grocery store in Crosby. It's beautiful over there, and you can pick up a snack on your way home. And there is Baxter, if you're from that area. So a lot of opportunities to get on in. I'm going to leave you with this. Don't know if you can see it. We got a skier on one side saying, "Keep old man Winter alive, keep him on life support." And then most of us are probably the other guy, the golfer. I say we shouldn't let him linger. So happy spring, everyone. Any questions about wellness visits?
Let me ask you, so what is included in the wellness visit? So in that blood work?
You can have blood work. Certain things Medicare covers: glucose, cholesterol, a PSA for prostate level checks. Otherwise, if you're on certain medications that require a yearly check, let's say you're on a thyroid medicine, we'd need to check a TSH, then those are usually covered not by your Medicare, but maybe any supplemental insurance you were to have. It's a good question. Yes?
So that is different than like physical?
Right, right.
Because if you bring up some other issue, like what happened to us, we got charged for that other issue, and I thought it was when we had our first wellness visit,
Okay.
it was more like a physical, they just changed the name, but no, it's not.
Right. Medicare feels that there's certain pieces that are preventative. You can always bring up other things. Oh, I got a sore back, or, I'm having trouble with arthritis. Please bring it up. It does help the full way of your care. But good old insurance, But hopefully if you have supplemental insurance, they'll kind of cover those extra little pieces. When in doubt, turn over your insurance card and call them and say, what exactly do you cover? Every insurance plan is different. I have tried to figure it out, and it's rough. If you want to save money and you don't want those additional charges, just be upfront with your provider and say, I'm here for my wellness visit. and what's covered there. Anything above and beyond, you can either set up a separate appointment, but we already got you in there. The copay's already in. Might as well just lay out all your concerns and get you up to date. Great. Yes?
So if you have an annual physical, does that qualify for a quote-unquote wellness visit?
Probably not. Right. So that's kind of a little key there. When you're scheduling, you'll want to say, I want my wellness visit. You can always add on and talk about other things, but your insurance will see, oh, they're having a physical, and will not cover that.
But that doesn't make sense because, okay, we're all getting seniors, we're already there, so why can't that, you know, and
I know.
it's like, now we're gonna come in another time.
Might as well get it all done on one day. Yep.
My question is, when you go in, they, you know, they basically do the blood pressure, temperature, and all that kind of stuff. But what would be the difference on what else would you be getting in a regular exam? It's not the wellness one.
Right, if you're getting an actual physical, it's more hands-on. So they might be assessing your lymph nodes, they could be doing like a pelvic check, kind of those extra hands-on things. And from the research I have done, Medicare, our government, does not feel like those extra hands-on things really improves health in the long run. So we do what we can do, and we make these visits enjoyable and fun. They're uplifting. They're not meant to harp on you or nag on you about, you know, increased weight over the winter or lack of mobility. We're actually there to support you. We meet you where you're at. We definitely enjoy our seniors and want to keep you guys thriving. Yes?
In order to get your medications refilled yearly, you have to go through a wellness check.
Right. I mean, truly, you could scoot out of the wellness visit and just do a med rec. So,
You can do that, but they still want a wellness check.
right. That's kind of, yeah, that's the way they get you on in. I mean, if you think of it, our insurance wants us to be healthy. So if we can get in and get you seen well, then they think that's, you know.
So our nurse practitioner does ours.
Yeah.
What would be the difference of having one of you?
It's just a different format. It's a team-based care approach. Either is fine. Everything is getting covered. We toot our horn doing the dual model with RN and provider. We take a lot of the extra computer work away from the provider so they can have more one-on-one with the patient, which I think is ideal.
We save money by going through the nurse practitioner and not seeing the doctor every year. Because
Sure.
she says the only difference is that I can't myself order your medications, but she said I talked to the doctor about it.
Right.
And then when I called, because I said it's your name on the prescriptions. So there's all these little angles.
Oh, yes. Yeah. Navigating Medicare is,
Well, you need to be your own advocate.
yes, you do.
People understand that. I mean, that's a powerful word for older people.
Absolutely. Thank you.
Nobody's going to advocate for you.
Nope, you should know what's in that booklet and know what is, you know, encouraged for you to do and what they cover, what they don't. Yep, knowledge is power for that one. Thank you for bringing that up. All right, anything else? Well, I appreciate you guys coming in and listening on this Saturday morning, and you're here to work on your wellness. Thank you. Exactly. Downstairs drinking their coffee and scones.